I'm thrilled to be introducing our keynote speaker, Dr. Elizabeth Comen. She recently has been on a media tour, so you may have seen her in your social media feeds. You may have seen her when you turn the TV on. She's been on everything from Oprah to Good Morning America and Today Show and all of the outlets in New York. But you know, Dr. Comen does more than just advocate for women's health. She's dedicated her entire medical career to saving women's lives. She's an award-winning, internationally sought-after clinician and physician scientist. Dr. Comen is a medical oncologist specializing in breast cancer, an associate professor of medicine at NYU's Langham Grossman School of Medicine. Oh, and by the way, she changed my speech this morning, so that's why I'm reading it instead of she earned her BA in the history of science because she's very humble. She earned her BA in the history of science from Harvard College and her MD from Harvard Medical School, then completed her residency in internal medicine at Mount Sinai Hospital and her fellowship in oncology at Memorial Sloan Kettering Cancer Center. She has won numerous awards and grants, including the Department of Defense Breakthrough Award for Breast Cancer and multiple grants from the Breast Cancer Research Foundation. She is frequently tapped by the media, from Oprah to every major news outlet, to break down medical news for the public because she speaks lay like me. And that's a trait that we need more of sometimes in the national media. She's a tireless advocate for women's health care. She is the author of the national bestseller, All in Her Head, The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today. We are honored to be hosting Dr. Comen as the keynote speaker to open this year's Magee Summit. And please join me in welcoming to the stage Dr. Elizabeth Comen.
All right, well, you didn't add to the intro that I love hip hop, so, next time I come, we're gonna bring a little Biggie for the crowd here. I am super excited to be here. Thank you to everybody for having me and for the abbreviated intro, because I didn't want the litany of all the awards and all that bores us all. But anyway, my first slide here. So the next Hera, if any of you know, that is the Greek goddess of women's health, childbirth, and keeping us all safe. And for me, you mentioned that I majored in the history of science. I am really passionate about understanding the intersection of medicine with culture, religion, history, and really unpacking the world we exist in today when it comes to healthcare. So the title, when I was charged with giving this keynote today, I thought, okay, so it's the world within us, the world around us, the world we form, and what's the common denominator here? The world. And you mentioned social media, you mentioned the media, and so much of what we think about medicine historically has been this idea that we're all striving for some objective truth. But the reality is, the truth that we discover is inextricably linked to who we are, the stories we tell ourselves, where we come from, our religion, and again, of course, in this climate, our politics. I don't need to tell us how divided this country can be, especially when it comes to women's health. And this is just a fun slide. Actually, the New York Post ran this article the other day, but it's the Sistine Chapel. And what you'll notice is there's a woman on the left there, and this is just really to highlight how much medicine is related to beauty, to art, to all of it. And what they noted only recently is that Michelangelo probably painted a woman who had breast cancer. If you look at the anatomical right breast, it's hiked up there, the nipple is a little more distorted than the one on the left, and this is a woman who probably had breast cancer and was depicted as that. And so there are all these medical sleuths out there that often look at history and art to find how were diseases depicted in the past. So a little bit of perspective on me, and then we'll dive in a little bit more. So I am a breast oncologist, and the thing that I've learned the most about treating women, thousands of women at this point, and to bring home this idea about truth and biology and what we think is objective about women's health, is that no two women experience illness in the same way. And that's why we're really here, to understand how we live better, how we thrive better. We're going to hear today about all sorts of data and biology, but how do we contextualize this is really what I am also interested in. And the stories that I've heard from women about their suffering, not just about the biology of their disease and whether it's estrogen receptor positive or triple negative or whatever it may be underneath a microscope, but the things that have held them back in their healthcare. Where's Jocelyn Fitzgerald, the urinary incontinence that they have after childbirth, so that even though while they've survived their breast cancer, they can't go on a trampoline, or the depression that they have, or the multiple sclerosis, or all the other things that lead into how they experience their healthcare and how they may have been dismissed over time in that. And when we think about the history of modern medicine, there are some great, and we have specialties today that are fantastic that have allowed us to become experts. But this fragmentation that really arose in the 19th century, I think has harmed women possibly more than men. We all want to be seen as whole people, as whole patients, but each of these specialties we know all too well often don't interact with each other, understand each other, have the chance to convene like you are doing today to work together and cross these bridges. But where have women been left behind in this fragmentation? I mentioned the field of urology. Well, when I was in medical school and very up until recently, I did not think about women in the field of urology, whether they were the doctors or frankly the patients. It was never women's genitalia that I thought of when I thought of urology. And so, as we all know, women's health, and I say this kind of flippantly, but it's not just our boobs and our tubes, but when you think about what many of us learned in medical school, it's the idea that gynecologists should be the ones taking care of women, when in fact, whether you're a gastroenterologist or a cardiologist, we are greater than 50% of the population, we are not small men, and we all know in this room that our biology is significantly different. But what has this fragmentation led to? We were talking about this a little earlier. So I would argue that there's an incredible amount of arrogance in medicine, this ivory tower sense that, people are going to come to these death by PowerPoint conferences, not this, hopefully you're not bored by me and my PowerPoint, but I speak at, whether it's like the American Society of Clinical Oncology, American College, blah, 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 but what information does the public really have? They're on Instagram, they're on Facebook, they're on TikTok, and who are the primary consumers of this information? Women. Because I think we have fragmented our care and not really allowed for the type of communication that women need and the care that they need in the doctor office. And we know that, this is a slide just showing that 46% of women aged 18 to 36 have had some experience at the doctor where they feel dismissed, ashamed, blamed for whatever they're going through. This is simply unacceptable. So why are we surprised that women are and young girls are trying to get their medical information from TikTok? And I would argue that it leads to this sense of chasing wellness. And we were talking earlier about, there's a great article in the New York Times about the wellness industry recently, about $480 billion. I don't know if that's a number that I'm remembering. Whatever it was astronomical and it was absolute madness. Imagine instead of putting this money towards unproven theories and sham treatments, that we actually put it towards the research that would advance women's health. But I would push us to argue, why is that? Why does that gap exist? And why are people capitalizing on that? And I would say that women's wellness is unwell. So this is something from 1896. How am I doing on time? Am I doing okay on time? Good. All right. So this is from 1896, not too different than what we might hear today. Quite often, the doctor is too busy and too hurried to make the necessary effort to obtain the facts. He frequently treats symptoms for what they appear to be on the surface, when the real cause and the real sickness is deeper and more dangerous. And then this guy goes on to say that, it's women's organs that make us crazy. But the point being that, read the first part. This is what people feel like when they go to the doctor's office today. When they have 15 minutes with their doctor, they don't feel seen, they don't feel heard. And of course, why are we surprised then that there's this massive industry to fill in these gaps, particularly for women? So historically, what gets marketed to women? I'll be brief here, but on the left is this is for constipation, a clean system and charm and beauty she would have if only she went to the bathroom better. In the middle, this was a compound made by a woman, Lydia Pinkham. These hysterical women, they're crying, they're sobbing, but if they just take her treatment, it's a 98% cure rate. Is this different than what we see on TikTok? Or on the right, this is one of my favorites. She was jewel of a wife with just one flaw. She was guilty of the one neglect that mars many marriages, and Lysol could fix her. This was an ad for Lysol douching. Literally, Lysol was marketed as a vaginal douche to women not that long ago. But think about all the colonics, all the clean juicing, all the juice, whatever. It's not different. So what does equity and equality really mean for women's health? And I would ask us to think about what's the equivalent of the laundry, the cooking, all this unpaid labor, all the unseen work that women do to make themselves feel better, because we have perhaps failed them. We are the primary caregivers, consumers, and decision makers for healthcare. And as Mike introduced me, I did write this book about beyond bikini medicine, really thinking about why is it that this title, All in Her Head, resonated with so many women? When I ask a group of women, including myself, how many of you have ever been told that it's all in your head or you're hysterical for whatever you're experiencing? Almost every woman in a crowd like this raises their hand, including physicians. That's simply unacceptable. So what are some of the gaps that I know that we're all here to think about today? This is Women's Health Access Matters Now. Many of you know this organization that has identified 4 really unique gaps, whether it's autoimmune disease, brain health. I mean, before I wrote this book, I had no idea that Alzheimer's disease was 2 times more likely among women than men. How did I not know that? I'm supposedly a women's health expert. Or that 80% of autoimmune disease are in women, but did I really think about that as a women's health problem? No. And we know that far too many medical students are taught that women's chest pain is atypical. Why are we atypical when we're greater than 50% of the population and it's the #1 killer of women, not breast cancer? This is, so I would, in the last few moments of my talk, I want to just pull it back to, this was from the NIH, right? And we all know that the budget is woefully limited for women's health care. And I was trying to make the point, I was looking for a slide to talk about bench to bedside and how it has to start from the research questions that we ask. Who is part of the world that we bring to the table when we think about women's health? It's all dudes here. Dudes in the lab and then as a dude patient. And I think that was pretty symbolic about what we're missing, because whether it's preclinical studies or bench to bedside in the exam room, too often it's been of mice and men. It was not until 2016 that the NIH even required that clinical studies or preclinical studies in animal models include equal representation of the sexes of the mice that we were working with. So is it surprising in my field then that we have little understanding about how immunotherapy or cancer treatments may differentially affect women versus men? Or that in my field, we are 2 times more likely to ask men about sexual side effects from cancer-targeted therapies than we are about women. In a few more minutes, I just want to talk to you about, what about women's mental health? Women are predominantly overprescribed antidepressants, and that's not to say that we don't need them. But going back in time, I just want to give you a little bit of framework. If I have a few more minutes, is that okay? Yes? Good? All right. So this is Dr. Henry Cotton in the 1920s. He was the most famous, bigger than Freud in the United States. In the 1920s, he had this seemingly brilliant idea, and I would charge our scientists to think about how a good idea goes really frickin' bad. So he thought, well, women are crazy. And we know that when you have a fever, you can hallucinate. So they must have some sort of infection that we can't see. And he was this pioneering scientist. And in this hospital in Trenton, New Jersey, what was he doing? He was removing all of women's teeth because he felt that that was the source of their focal infection that was making them crazy. And when that didn't work, he would remove their gallbladder, he would remove parts of their colons, and maybe if he felt they were not fit to be pregnant, he would remove their ovaries. So this was a good idea gone real bad, and thousands of women had this happen to them. He claimed an 80% cure rate when he had a 30% mortality rate. What about Walter Freeman in the 1940s and lobotomies? This was done absolutely predominantly on women with severe, often life-threatening and limiting consequences. Or the tranquilizers of the 1960s for the anxious housewife. Now she can cook breakfast again, or you can help set her free. You can't set her free. No, we can't set her free, but you can help her feel less anxious. These were ads in medical journals. And what about today? So I had a patient the other day who had menopausal symptoms, and her doctor was just prescribing her antidepressants, as opposed to thinking, well, maybe she's miserable because sex feels like sandpaper, or she has hot flashes. Maybe an antidepressant isn't the obvious Band-Aid to put on this problem for her. And I'll just quickly walk through. Do any of you know the discovery of hormones? This guy on the left, Dr. Brown-Séquard, was famous in France because he was actually the beginning of hormone replacement therapy, but for men. He was crushing up guinea pig testicles and injecting himself with them and claiming that this was the source of his virility. But it started off this path of what's the thing that's going to make men great, ultimately the discoverer of testosterone, and the thing that's going to make women, well, it's whatever's making them batshit crazy. And I said that, yes, batshit crazy, because that's what women were assumed to be. So this binary approach to medicine is what screwed us over to today. We have no idea how to give women testosterone, or if we really should be, or that men actually make estrogen too, and how that may influence their health. So when I have a patient in my clinic where our treatment for breast cancer is effectively castrating women, and this can be women in their 20s and their 30s, we really don't know how to help them as well as we should. And it's only until very recently, up until now, that we've done the appropriate studies to show that intravaginal estrogen is not absorbed systemically and does not actually increase the risk of breast cancer. There's no world where we would be saving men's lives by castrating them, but having them suffer from erectile dysfunction in their 20s through the rest of their life. But that's what we've effectively done with far too many women. This is a diagnosis that was predominant at the turn of the 19th century. Women were told they couldn't ride bikes. Why? And this was in JAMA. You can read my book. It's all over the place. That women's faces would be stuck in a grimace if they exerted themselves so much. So are we surprised that this middle woman here, you know how they described her? As having a bicycle face and developing bulky muscles. Why is it then surprising when I go to my Pilates class that the number one frequently asked question is, will this make my muscles bulky? Will I look, like a dude? Will I look like Hulk Hogan from doing Pilates? Why are we worried about that? What have we taught women about exercise along the way? On the left is just to show you the intersection of society and medicine, is a woman it's an effigy of a woman on a bicycle that was hung out of Cambridge University when they tried to make it co-ed, to symbolize that this was just not acceptable. And of course, the bike became the symbol of the suffragist movement as well, and movement and mobility from the home. So what about the female athlete today? Why are we so behind in trying to understand ACL injuries? We're so focused on concussions in male athletes and football players, but what about in women? Or what about the fact that 1 in every 4 women suffers from severe intimate partner violence, many of which can include repeated concussions? So when they go to the emergency room, the doctors think they're high or drunk or something like that, when really they can't remember anything because they've been hit in the head so many times. What or who are we valuing in our society? So I would think about when my patients have no idea how to do a squat, or worry that when they're going to lift heavy weights that they're going to look bulky. Again, what have we taught women about strength and power? So I'm frequently asked, and I'll finish up here, and I thank you for letting me go over time, what are these 10-step things to wellness? There's no 10-step guide to wellness. If I tell women you got to start getting your mammogram at age 40, but she's scheduling her kid's dental appointment or taking her mother to the cardiologist because no one else is going to, it doesn't matter what I tell women to do for themselves. We know that we need to value women's health, but we need to push our society to do so. We need to think about the world within and around us and the world we form as not just in the laboratory and in the exam room, but the philanthropy that we engage with, the government that we engage with. There is so much division in this world today, but I would push us all to think about how we can cross those bridges so that the world is far more intertwined than divided by all these wars. So although the world is full of suffering, it's full also of overcoming it. And when I get the privilege and honor of speaking to such a group as yourselves, this is where I really find the joy and passion to help me thrive in this work. And I hope you feel empowered by it too. And I would challenge ourselves to tell a different story, especially in these times today, to ourselves about what it means to be a woman, how we value women's healthcare, to our patients in the exam room, to our laboratory collaborators who might have very different frames of references of what they see under the microscope and how they value that. And I really believe that together, you in this room, aligned with the same mission and partnered in it, can be part of changing the world. So thank you so much for your time and having me here.